So this is going through 4-lead EKG placement, 12-lead EKGs placement, and then plugging the information into the monitor. So everyone knows where to grab everything out of the monitor. It's in the left pocket. We have our 4-lead cables, our 12-lead cables, and depending on how your monitor is set up, you'll have your electrodes on that side. We always want to start with a 4-lead. It gives us a base EKG to see if we need to maybe continue down the 12-lead path, or we just have to start with a 4-lead to hook the 12-lead to no matter what. There will be videos on adult and pediatric placement. With the leads, sometimes they're called limb leads, but you have 4 of them. So you have right leg, right arm, and you have left leg, left arm. So one of the mnemonics you can do is smoke over fire and then sky or clouds over grass. So that's going to mean you're going to have white over green and black over red. And this is using the trunk method, where you're basically putting the leads on the torso of the person. So they're going to go right at about the hip line and up on their area right around your traps. Anytime you're placing any leads, you want to not go over bones. Sometimes it can mess with the way that the EKG gets its readings. Our 12 leads plug right into our 4 leads. We'll take the extra sticky or electrode that we had from that first pack, and then we'll use the second pack, and it's the perfect amount. So these are going to be numbered 1 through 6. There's no order that you have to put these on. They just all have to be in their correct places. For the purpose of this video, we'll go 1 through 6 numerically. So 1 and 2 go on the left and right side. So 1 will go on the patient's right. It's going to be in between the second and third intercostal space. That means the space in between the rib bones. They should be parallel with each other. Sometimes I find that it's easier to put 4 and 6 first and fill your gaps with 3 and 5. 4 is the nipple line directly below. 6 is mid-axillary, so it's the armpit line in line with V4. Five fills the gap between 4 and 6. And 3 is a 90-degree angle between 2 and 4. We will then plug our 4-lead into our 12-lead. On the monitor, on your home page, you'll hit 12 to go into 12-lead. Hit the chart, the second one down. This is where we're plugging in our patient information, age and sex, as well as we're trying to get in a better habit of doing first and last name initials, so that if and when we're transmitting to the hospital, they can have some patient information. You can use the row buttons if you want to go quicker, or just use the arrows. Go down and exit out. The last button that we're doing is the actual image of the 12-lead. This is when we want to tell the patient to sit very still, don't talk, try not to move, so that we can get a good picture of their heart. And then we'll have any findings come up on the screen of our monitor, as well as we'll have our 12 lead printout.